Hello friends, welcome to my channel Med Simply Learn. Today I have got a very interesting topic, that is albumin creatinine ratio. Let's start the video. So a brief introduction. It is a very important diagnostic test to assess the kidney function. Moreover, by definition, it is the ratio of albumin to creatinine in the urine sample, and it mainly detects albuminuria, which is a marker for kidney damage. Now, after seeing a brief introduction, let's discuss the applications of this test. First of all, it helps in diagnosing the kidney diseases. ACR is considered a very important early marker in identifying the kidney diseases like glomerulonephritis, diabetic nephropathy, and we all know that earlier is the diagnosis, better is the management and outcome. The second important application is monitoring the disease progression. Regular ACR checkups can help monitor the progression in chronic kidney diseases, thus enabling timely intervention and preventing further kidney damage. Finally, it also helps in predicting the cardiovascular risk. Thus, it is a useful marker for cardiovascular disease prediction and prevention strategies. So what are the advantages of this albumin creatinine ratio? First advantage, as we have already discussed, is it acts as an early marker for detecting kidney damage, thus allowing timely management and intervention to prevent disease progression. Now, the second advantage is it is a non-invasive and a convenient test, making it an ideal choice for regular screening and monitoring of patients. And lastly, cost effectiveness. Compared to other diagnostic methods like various radiological tests, etc., ACR is a cost-effective test, thus reducing the healthcare expenses while maintaining the effective monitoring and management of patient. Coming to the limitations of ACR, ACR has certain limitations. The results can be affected due to number one, hydration status of the patient. If the patient is dehydrated, it can falsely increase the albumin creatinine ratio of the patient. Secondly, if the patient has performed some exercise before giving the sample or has undergone any high physical activity, then also results can be falsely raised. Other than that, fever and interference by certain contrast agents for used in any radiological test can also affect the test results. So, interpretation should be done keeping all these factors in mind to enhance the reliability of this test. Otherwise, misdiagnosis make it up. So what are the various approaches to measure the albumin creatinine ratio? First is the spot urine test. It is the most common and convenient method. Single urine sample is given at any convenient time of the day, or the random sample also it is considered. Second is early morning sample. Sample is collected early morning at home by the patient after waking up from sleep, and it is advised that midstream sample should be taken. And lastly, 24-hour urine collection. It is the gold standard because it gives a comprehensive assessment of protein excretion, but it is less favored due to logistical difficulties. Now let's see the calculation of albumin creatinine ratio. Formula is albumin concentration in urine in milligrams per dl divided by creatinine concentration in urine in grams per dl. So the unit will be milligrams per gram, and the reference range is less than 30 milligrams per gram is normal, 30 to 300 milligrams per gram is microalbuminuria, and more than 300 milligrams per gram is macroalbuminuria. So what are the factors affecting the ACR ratio? First of all, hydration status. Hydration can affect the concentration of the urine. So dehydration can artificially elevate the ACR levels, thereby complicating the interpretation of kidney function. Secondly, exercise. Intense physical activity can raise the plasma creatinine levels due to increased muscle metabolism and thus falsely can mimic renal impairment. Finally, high protein intake can transiently raise the creatinine levels, which can lead to misinterpretation of ACR results. So, what is the role of ACR in diabetes? Elevated ACR ratio in diabetic patients signal the early kidney damage. So, intervention should be done to prevent progression to the chronic kidney disease. What are the guidelines? Guidelines suggest annual screening in diabetic patients, in type 1 patients after 5 years of diagnosis, and type 2 patients upon diagnosis. Finally, what effect it has on management strategies. If increased ACR levels are seen, then blood glucose should be controlled and ACE inhibitors or angiotensin receptor blockers should be started as necessary to protect the kidney function. So, what is the role of ACR in hypertensive patients? Higher blood pressure can lead to compromised renal blood flow, consequently increased albumin leakage into the urine. Thus, ACR can be a very important clinical tool in hypertensive patients for detecting kidney damage. Coming to the monitoring guidelines, patients with hypertension are advised to undergo annual monitoring to assess overall risk and adjust treatment modalities effectively. And finally, the impact on treatment. ACR levels can influence the treatment choices like the use of antihypertensive medications to mitigate the risk of renal and cardiovascular complications. Finally, let's see certain global guidelines for ACR monitoring frequency. First of all, WHO says in individuals over 50 years of age, annually ACR should be monitored, and if it is more than 300, medication should be started, and if it is less than 30, then lifestyle changes should be made. KDIGO guidelines suggest 6 monthly frequency, and again impact is increased monitoring and change in medication if ACR results are found to be high. NICE guidelines recommend frequency based on the risk factors like diabetes, hypertension or cardiovascular risk factors, and impact is dietary and medication adjustments with high results. Finally, American Heart Association have suggested that annually the ACR should be monitored in hypertensive patients and medication should be reviewed and health screening should be done for elevated ACR ratio. So friends, that was all about today's video.